Sanitation and Hygiene Protocol of 2023. It moves to some I don't know how many of you know about this document. I'm sure maybe all of you have seen it. It's for the Ministry of Health, and it gives categories. This is the one that we're using at the national level at the Ministry of Health, where there's the G open defecation G1, the G2, and the G3, of which the safely managed is the G2, and you can be the clean and healthy. So there's also the issue of how does that protocol relate to other indicators that we are supposed to report on, or the frameworks that we are reporting on. The JMP and SDG, the JMP is the same as SDG, and they have those service levels. All of us know them, the OD and improved and limited and all that. How does that G1, G2, and G3 relate? I think as even we are talking about the value chain. Somebody talked about the household. A lot is happening at the household, and these protocols are looking at the household level. They also maybe have a gap because they are not looking after household where next. So at the KPIs, I think that's where they are looking at them for urban. But what happens to peri-urban and rural? If you're having a sewer, say a septic tank at the rural at your home, does the value chain, is it being taken care of by this? No. Is it being taken care of by the KPIs of the urban? So that those are some of the questions we need to ask ourselves. These ones I'm not going to read through, but under the National Sanitation Management Policy, they have highlighted, it's a document I think, as I said, all of us need to look at, the strengths and opportunities and the gaps. And most of those gaps, we have had them again and again, and I'm sure they were even mentioned here, these overlapping institutional framework, arrangement. Example, like today I had Carol from Kisumu Water talking about the utilities. Utilities have a PROPUA department, I think even now. That PROPUA is doing some sanitation. They are even doing some latrines and all these things, and it's something that has been done in the last few years. If you go to the Department of Health in some of these counties, they don't know what is being done by the utilities. Sometimes the responsibilities overlap, and then it's not possible to track data or to keep track of what is going on here and there. So it's not always the case, but in most cases. So there's other issues. Maybe you can go back and look at the document because I don't want to run through all those gaps. Some of them are financial gaps, human resource constraints, but the ones that may relate so much on the on-site sanitation, it's the first maybe three. There's the institutional framework, the institutional functions are fragmented. There's also lack of coordination, and there's also the devolution. Even at this time, we are in 2025, and devolution happened 2010. There are still teething gaps on the roles of who is supposed to do. We know what sanitation is devolved, but sometimes even in terms of, say, financing, sanitation has never had a budget line. You go and find there's a health budget, but there's no sanitation budget. And it comes from exchequer. There's no budget line for like the other sectors. So some of those gaps are still existing. And within this National Management Policy 2024, we've talked about these issues. Actually, as you said there, they have about 13 objectives of this document. And they touch on a lot of things. We've been talking with the sector for a long time. But most importantly, they talk about promoting non-sewerage sanitation in terms of technology and services. So what are the existing gaps? They already said here, licensing, for emptying transport services, treatment of fecal sludge. They are not well defined in most counties. And it also cuts across multiple government institutions. There is no fecal sludge management regulations and quality standards for handling reuse, example in agriculture, such as fertilizer, feeds, fuel, etc. Example, sometime I was working with Umad and I saw the lady from Umande Trust. They have these biodigesters in Mukuru and everywhere. But once you get the biogas, what do you do with the bioslurry? You can't just use it as fertilizer. You don't know whether it's treated. There's no regulation. Even to carry it from wherever you're supposed to remove it, it has no, it's neither here or there. You can decide, let me put it on the flowers. It could be contaminated. Those are some of it. There are no standards on how you use these things. At the same time, I don't know, maybe if somebody from somewhere like Sanaji will tell us about even the animal feed they make, what are the standards? You know, there are few people doing that, like these, what do you call the worms? They call the army worms. The ones you make from the container based. So the standards for this, because there are not many people doing them, they are not very comprehensive. Now also, there are no comprehensive SOPs, somebody said that earlier, on sludge emptying, transport, treatment, and also tariffs. So how much do these boozers or exhausters charge? It depends whether it's in Nakuru or maybe Kisumu, but in general, there's no a standard, say, document that can give a certain structure. So then also, even construction, there's no adequate guideline on, say, some of these infrastructure, such as septic tanks and all these things. Again, someone talked here about Kisumu, how they are dislodging into the sewerage system. There are no decentralized treatment plants for fecal sludge. And I think only a few, I saw they have in Busia, I think, and Nakuru, a few utilities have. Maybe they cannot reach 10, maybe even 5. So there's a gap where maybe there's an investment that needs to be put in for decentralized treatment plants for fecal sludge. This is a kind of operators we are talking about. This picture, I took it for manual pit emptiers at Mukuru, I think 2019. I'll give a case example before I stop. First, before I go to the manual pit emptiers, in a national management policy, they have made out a strategy of 21 strategies, and you look at them, and most of them are speaking to some of the issues we've been speaking about here, on how to promote low-cost, appropriate on-site sanitation technologies, and also how to do needs assessments, also to do to categorize the rural sanitation needs and urban. There's also integrate solid waste management. I saw something about even diapers and pads and this kind of thing in that document. So it's, after reading it, you see if it's implemented, we may see the light of, at least some light tunnel at the end of the tunnel. So they also talk about engaging utilities in relevant sector institutions for provision of safely managed non-sewer sanitation services. And the approaches they plan to use there, they are right-based approach, countrywide or citywide inclusive sanitation. And when you think of that now, you also ask the question I was asking earlier, how far is the rural, where is the boundary of rural and urban? So that you're able to see whose mandate is whose. Until that is done, we reach to a point we know this is where it reaches and this is your mandate, then we'll be saying at least we've moved one step ahead. Then also they have the service, sanitation service chain approach, where you are thinking about the whole chain. I'll not repeat from the containment, emptying, conveyance to treatment and use. Then, and also abstraction of, they also use the water cycle approach, where when you talk sanitation, you also think water. When you're abstracting water, you're also thinking about underground contamination by sanitation, maybe latrines. When you think sanitation, when you're at the household, you're also thinking about hand washing. When you think about transportation, you're also thinking about these wet use of water-based, say, sanitation processes. When you're thinking about reuse, you're also thinking agriculture, water. So it's also integrating the water. So why voluntary regulation? Well, now we have that background I've given, then you're able to see where are the gaps, because different cases call for different solutions. They also. So I will not talk much about this because we already have heard about the voluntary regulation, what it is about, where it's a self-driven, collective, accountable and all that. One quick one before I finish. I talk about the manual pit emptiers, and an example of, say, a classic case of voluntary regulation is where they have an association and they check on people who are dumping in designated areas. They train each other on operations, use of gear, topics such as anti-drug abuse, GBV, use of smartphones when they are doing their work. They also report their violators. They have discussions on how to save and improve their businesses. And they work together to develop SOPs and use of PPEs. And they also do other issues like we were told earlier on vaccinations and insurance, to register as groups in the health insurance. So they improve themselves, and also they work together peer to peer, as we were told. We have one like this in this picture from Korogosho. They work with some groups that are in, I think, Kiviwadani. So they collaborate. And lastly, so the role, as we said, in general is to fill the gaps, not for the national and where the regulations are weak, code of conduct, SOPs, and also they get trust, and they also become formalized. So over time, they are able to become formal. They are not informal anymore, and they get trust from the communities. And with that, I finish. Danke.
Thank you very much. So we've heard from the scope of where we're at with self-regulation. But now, with the constraints that we have, as Mother has mentioned, in terms of geographic context, in terms of resourcing, I understand that only about 31% of Kenyans have access to sanitation. In terms of water, 70% of people in Kenya have access to water. In terms of funding, only 0.5 of county government's GDPs is allocated to sanitation. So, Prof, in light of these constraints, could you help us just look at how could we balance ideal standards with what is actually feasible? Thank you. I think I'll give you just 7 minutes because you're literally out of time.
Good morning. Just a correction. I was acting Vice Chancellor at Umma University, but I'm not there anymore. I'm in Amref University. To answer Marcy's question, I think we need to look at sanitation as a process that comes from human creation, the product of life. So we waste our waste products. What we generate as a process of life is our concern. And historically, it has been handled in different ways. I remember 1974. I was working in Kisumu when there was a big outbreak. As a very young person, there was a big outbreak of cholera. And we thought of enforcing the law under the discussion of regulation. And we used Cap 242 of the Public Health Act. And we forced people, because we knew the only way to control cholera was for them to have toilets. And we took some of them to court, those who did not have toilets. And many toilets were constructed. Very beautiful, 2 sheets roof, simple superstructure. There wasn't much depth, but something for the daktari. But the people did not use it. And the factor was that there was a cultural aspect that was prohibiting the utilization. So when we are talking about what is ideal, in the coastal area, they wouldn't go into a toilet that has no water, because the Muslim community would use water. So when we are talking of standards and trying to talk about issues, then we also look at the human. Long time ago again, the elderly would not use a squatting toilet because it would not be ideal. And then there was a time we were also struggling with the poor flush. You know, the poor flush toilet, where you use the toilet, there is a kind of assistant, not assistant, there. You use, it is a pit latrine, but then you pour water. Now the elderly and those who are maybe HIV positive could also not use it, because the other people, stigmatization of HIV. People who thought that these are people with HIV, I can't use the same toilet. So when we are talking of standards of sanitation, culturally and historically, we have gone through a long process. And I want to also share, and I shared in a recent meeting. I went to Japan. I studied in Japan briefly for 1 year. And the toilet there, you don't touch anything. You just press buttons. And you rotate and it cleans you with water. There is hot air that comes in, dries you up. But if you are not careful, I made a mess and touched the wrong button, and there was too much hot water. These are standards of latrines and toilets and the development of it. But I think we need the basic minimum standard, because this human waste that comes out of us is the concern. It has to be handled in a dignified manner. The toilet you go into must be a place that when you come out is a respectful circumstance. It has to be acceptable. If it is an elderly person, even if it's a pit latrine, there should be a pedestal. So these are the kind of things that people would look into in terms of a latrine. In urban areas, Nairobi and the others, Kibera, there was somebody in the morning. We attempted as a research component to clear the Nairobi Dam, but there was too much human waste coming from Kibera. And how do they do it? During the rainy season, exhausting is expensive. So during the rainy season, they open the water canals to enter into the toilet, fill in the toilet. It raises the content, and when the rain subsides, the content of the toilet is in the streets, and the toilet is at zero almost. So now if we are coming with standards, that is because exhausters were expensive. I think it was UNICEF in Kibera who attempted to have a mobile exhauster that went around into the community area. So when we are talking about sanitation and the standards and what is ideal, I think we need to take into consideration. Historically, we have changed. In Kisumu now, I think in the past, people could not use the same toilet. So in order for you maybe to consider if the cultural practices are still there, is to have separate toilets maybe, so that because it is this stuff that comes from us that we want to manage well, because it's a media, there are pathogens there, they transmit disease. Now to consider standard, you must think of a way that a toilet will not be a source of infection, but it will control diseases transmission. So when we are considering the standards and regulations, I think it will be very important for us to consider those factors at the local level. And I believe I have been involved in the development of the sanitation policy and the other documents. But there is a lot of diversity in the communities that we need to take into consideration. And self-regulation, what I thought was the commitment of the people. It would be at different levels. For example, at government level, at the devolved government level, at the community level, at the CSO's level. I think this would be different. For us to expect self-regulation at the community level, the community must buy in. And the only way to do that is strong advocacy for them to accept. Right now we are using CLTS as a method of disgust. That if you don't have a toilet, you're causing problem for others. Can we change it? This was Bangladesh something design approach. Can we change it that if you have a toilet, you are recognized, not rather than disgust, then we change it that having a toilet is more positive than not having being negative. We need to look at what works in our situation locally. Regulations are good, but if the community does not buy in, then they will find a way of not following the regulations. So we need to define this self-regulation through commitments. Like now we have our own commitments for the country. I think in different levels they have what they need to do. I think in this way we all need to be committed to the objectives of sanitation and to understand the benefits. For example, at governance level, there was a document that showed that if we had a good coverage of sanitation, we will be able to save 2.7 billion from diseases that are transmitted, or the cost of managing diseases. Now it could be even much, much higher. At the CSO's level, possibly they need to understand that maybe self-regulation will be able to guide into maybe more impact in managing the situation and acceptance by the people. And at the community level, I think this is also an area that we need to consider and see how best we can have the people buy into sanitation as something that they need to do it themselves. To me, self-regulation at the community level is something that will not need to be enforced. It's the people themselves to be able to accept that this is a necessity in our life and that we should be able to do it. And I thought that would be what we could consider in responding to Marcy's question. Thank you very much.
Thank you so much, Prof. I think the insights that you've given us are really key. Looking at the whole geographical landscape of who are we targeting when you're talking about self-regulation, and also why it is necessary and now we can actually actualize it. And I like the fact that when you talk about rural communities and at the household level in rural communities, you're talking about incentivizing as opposed to shaming. Before we even talk about regulation, could we talk about, first of all, advocating for self-regulation such that the communities themselves are incentivized to do it? Next, I want to ask Engineer Maluki maybe to step up. Yes. And the question that I have for you is, I know as engineers we are really technically rigorous, and we have high ambitions for how we want, like sanitation to look like, and how even the self-regulation want it to look like. As Prof was sharing the example of self-cleaning toilets, we'd want to get there someday. But then how realistic is that for us as a country? So my question for you is, in the context of Kenya's sanitation landscape, achieving a balance between technical rigor and practical implementation in voluntary on-site sanitation regulations is still a challenge, but how can we design realistic and adaptable technical standards and performance benchmarks that you'll be able to promote compliance while at the same time ensuring affordability and accessibility?
Thank you very much, Mercy. I think that's also a very good question because we are actually talking about self-regulations. But before I say that, perhaps I also want to make a correction of the introduction that was meant on me. My name is Francis Maluki. I work for Water Services Regulatory Board. We call ourselves WASREB. We are based here in Nairobi. And I'm not, you call me an agricultural engineer, something like that, but I'm a water and sanitation engineer, of course, even a civil engineer. So I work at WASREB. I work for WASREB, rather. So now coming to the issue that the question that you're asking. First of all, we need to ask ourselves, because you have asked about the balancing between the rigor and what else? Rigor and there's another word that you had posted there. Yeah, rigor and realism. If you look at it that way, now we first of all need to understand these words, so that at least now as we discuss, we are able to know what is the point that we are driving home. What is rigor? Rigor to me here would mean, because we are balancing rigor and realism. Rigor here would mean something stringent, something strict, something severe. Yeah? You see now, if we are talking of something very strict, it's like these regulations that we are imposing, or the one that we are setting, how strict are they for them to be complied with? That is the one. Okay? Now come to realism. Realism here would mean actually the reality. Are they practical? Practicable? I mean, can we be able to apply them? And now that is what I'm being asked now to balance. Is that the case? I think that was the point, according to what I've just understood from the question. Now, if we start with this self-regulation, the self-regulations, because now people regarding the issues on sanitation, if we want to self-regulate ourselves, first of all, the standards that we come up with should actually also be strict. Because if they are not strict in any way, then it means in a way at least we could be able to follow them from the onset. Because anything that is just done haphazardly without any strictness can be followed, isn't it? But now there should be a certain measure, a certain standard of that, a certain level of standard that we need to have. And this is what we call a benchmark. We sort of set a benchmark for us to be able to achieve. We say, now when it comes now, for example, because Professor here has talked about the toilets and the standards that are there, and how you are seen in Japan and the rest, we need to look at, in our local context, the standards, the toilets that we have, for example, because now we are talking of on-site sanitation, which would entail issues to do with the toilets, the VIV toilets, for example. We could have the septic tanks. We could also have the composting toilets. Now, the standards, when it comes to construction, part of it, and the design, what level of standard we put into that, so that now it is also acceptable. It is also something that can be applied. But also, when we are doing that, we need to consider a lot of aspects, because there is also the cultural, socio-cultural factors and barriers that can also affect all this. So there are some considerations that we also need to do as we also come up with some designs and some kinds of construction that we need to make for our on-site sanitation. What are these? For example, if we are constructing a toilet, what would be the standard measure which you would know very well it's affordable, it is something that can be allowed in the culturally, either because we know some communities may not share the toilets. Then it means if you are to construct a house, a toilet at homesteading, perhaps you may need to have one that is not shared. Like two. One which some people would go and another one which other people would attend to. In that case, if you are doing it at homesteading, that could perhaps be a standard, right? So that now that barrier, because now what you are looking at here is to make sure that this person at the homesteading can be able to respond to the biological call, because this is a need. If there is that call, where do you go? Do you say, because my young people here have used this one, I'm not going there because I'm an old man? No. Then if that is the case at that level, you need to look at how best you are going to do that, so that it is it can be applicable. It can be used by anybody. That's about construction and design. When it comes now to, because there is also the operation and maintenance of the same, you need to consider that also as another aspect. This toilet that I'm coming up with, this septic tank that I'm coming up with in my my area, or whatever place that you want it used, when you consider the issues of operation, when you are going to open the door, because it's to be able to operate and maintain, it will be used the way Professor was saying. You should be a pour flush kind of toilet, but there are other areas which are also not advocating. Like examples in South Africa, for example, they are not advocating for toilets that are waterless. You should have facilities that you can also be able to use water. I think this is because they want that toilet to be connected, that wastewater to be connected to a sewerage system, in their case. But in Kenya, because we are looking at the Kenyan context, we need to have pit latrines, we need to also have those septic tanks and the like. So the best thing here to do is to make sure that when we are looking at the whatever standards that we need to have, should actually be not very strict to a point that we are not going to comply. And again, they should also have some benchmarks. They should be practical. You should actually be able to apply that. If you are not able to apply that, that means then regardless of whatever thing that you plan to do, you will not achieve. You will not be able to achieve. And that is the basis of what I'm being told to balance here. What can I say on top of this? When looking at the areas like India, actually they have what there was a movement that they were calling it a Swachh Bharat mission, SBM, Swachh Bharat mission in India. This mission was actually looking at how best, other than advocating for provision of toilets to the communities, they actually thought the best approach to this is to have behavioral change for the communities. And now they started now advocating for training people, creating awareness of the best approaches on how best you can, how you can be able to do regarding environment, regarding the way, the behavior of people in terms of, because there were there were also socio-cultural barriers. There are also other people who are not able to do what is required of them regarding issues on sanitation. But now they've changed the behavior because they were being trained. They've actually been making that movement from village to the other larger communities and that kind of a thing. So everybody in that community is well informed of the awareness and how best they can be able to control their waste. So by so doing, they have changed the behavior. The impact here is to make sure that the environment is well taken care of in terms of contamination and pollution. To make sure that even by so doing, they have impacted community very well, and they are no longer having many diseases as they used to have. So that is the thing that I wanted to say about how best you can be able to balance between the standards that we have, the guidelines that we have, as we now self-regulate. Think of whatever standards that you need to come up with, but of course they should be strict, there should be rigor, there should be sphere in a way, but also making sure that that severity is not to the point that you are not going to comply. The person that you are, because it's self-regulation, you are the people on the ground who are going to apply this. Is it applicable to your case? Is it also serving you with the whatever standard that are there? If they are not if they are not serving you, then they are not good standards. And I think that's perhaps what I can say for now, unless you have more questions. Thank you.
Thank you. Please a clap for Engineer Maluki. So at this point I want to just go back to our panelists and engineer, because you just stepped off the stage. I will start with you. Just so that people don't lose track of what you're talking about. And you're talking about technology and, looking at performance metrics. And I think for me, I've heard a lot about what you've said about balancing the technology and what is balancing technical rigor and what is real and what is possible. And in that sense, I just wanted to ask, how can these sanitation standards be monitored and enforced without necessarily creating a burden for households and service providers? Because yes, we want to have them regulated, we want to self-regulate, but how can we make life simpler for everybody?
If I'm getting the question is, first of all, you need to internalize the question before you answer. The question is that how are these technical, maybe perhaps you can
yes.
paraphrase that?
Yes. So we have the technical rigor in the standards that we are setting, right? Yeah. But then how are we monitoring them in a way that is friendly to the households without necessarily being burdensome to the household and also the service providers?
Okay. Thank you very much. I think now I get your question. Before I continue on answering at the level of the communities, perhaps I may want to say how we do it as the regulator. Because I'm being asked, how do we monitor these regulations, the standards that we have? How do we monitor, not regulation, how do we monitor these guidelines and the standards that we have so that we can be able now to achieve what is required? One, as the regulator, monitoring is done in a way that we need to ask the utilities, because the utilities are the ones who are bestowed with that responsibility of dealing with the wastewater, with dealing on on-site sanitation, and also at the level of the county governments, this is a devolved function, meaning it is the county government also who have also that stake to make sure that whatever is being done at the account level, it is monitored. It is because you want to monitor to make sure that there is effectiveness in what standards that we've set across. That is actually the importance of monitoring. You monitor to make sure that all the standards that are there, all the guidelines that have been set are effective. If they are not effective, then it means things are not working in the right way. So, as the regulator, we make sure that there are inspections that are carried out to the various WSPs, that is water service providers, to make sure that now, specifically if we are talking about on-site sanitation, we go and inspect in collaboration with the Ministry of Health, so that we can be able to ascertain that certain levels of standards have been realized. Recently, we've come up with the key performance indicators on sanitation, which we need to be following to be able to make sure that, to monitor the levels of customer satisfaction. We can also monitor the effectiveness of the facilities that we have, and we can be able to measure whether whatever standards are there are actually working in the right way. So basically that's how we do it as the regulator. But now, because we are talking of the self-regulations, we are asking ourselves, how effective will this be done? So that at least as you now do the work, because you want to come up with the self-regulations within yourselves, perhaps the only way I can say in this case is on self-regulations, we can employ the issue of the matatu industry. You've seen how the matatu have come up with cooperatives so that they know this matatu flies certain route and they're supposed to go to another route like this and that kind of a thing. And if another person or even other vehicles flies that route, then it is obstructed from doing that. And then there's a kind of money that they also pay to become a member of that cooperative. So equally, perhaps our communities or even the sanitation players can come up with a kind of organization whereby they know so and so is the one who is actually operating within this area, another person is operating within this area, and then they can be able now to do self-regulation. The other thing is a question that I always ask myself. We've been, if you walk along all the estates that where you live, for example, most of us here live in Nairobi here at the urban areas setting. Especially when we have rain season like now. What do you see next? You may see the flow of waste or flow of water, storm water along the roads, or the one which is also flowing at those collection chambers, those stormwater channels. A case which is not supposed to be like that. So we're asking ourselves, if actually you have your car and you are driving to your home and you see this waste, or you pass through that waste, what you take home, your wheels actually catch that, they take back to your garage, they take home to the garage some waste, which is impactable when it comes to the issues of contamination. Because you are going, perhaps even at the garage, sometimes people stay there, they live there, they can even eat there, especially when their car not packed. So that becomes a health hazard, because now you are carrying this problem, this waste, through the wheels of the vehicle to the back home, where you are parking your car. Even the food, as you step along the road and all that kind of a thing, what are you taking home? That dirty thing. Now, the question that I've always asked myself is this. Who is actually responsible for this? We normally say it is NEMA. But of course, what initiatives have you taken as an individual to report to NEMA? Because NEMA cannot be everywhere. The WASREP cannot be everywhere, for example. Who has taken initiative to make sure that now you report on that waste that you are seeing so that action can be taken? We normally see this. Is it true? We normally see this waste all over. But we ask ourselves those questions. always responsible because it is individual. If we change our culture, the way we operate, the way we do things, perhaps we'll be able to regulate ourselves. So it requires commitment from ourselves, from the government, from the all the players. That way you can be able to achieve what is required. Thank you very much.
Thank you very much, Engineer Maluki. A clap for him. Our time is up, but it'll be very unfair if we don't take a question or a comment from the audience. So I want to open it up to you in 1 minute. First come, first served. Yes, please. So sorry. Okay, I'll take a question from you or a comment in 1 minute.
Thank you. My name is Blenza Sires from Uganda. Currently working with SDI Kenya with Muungano na Vijiji. Professor Muhammad, you highlighted something to do with culture. And I was wondering about what Engineer Maluki mentioning about technology and the realism. Something that I would like to share. It may not apply here, but it's also considers to the practical sense. There are certain technologies that might fit in Africa compared to the diversity that we have here. Toilet that can generate by basing on what humans consume. In Uganda, there's a pilot that we had begun considering the inefficiency in regards to accessibility to emptying toilet. Once the toilet was constructed with the biodome at the bottom, on top of the building, there was residentials that were to be accommodated, meaning the residents would release the fecal sludge, and the fecal sludge will generate biogas through the biodome and to generate energy for being used to manage the climate effects of insufficiency when it comes to energy. But it was found out that much, even to that, us was a pilot, but also in regards to the authority, a further study had been made that much of our fecal sludge cannot generate biogas simply because we don't consume more of legumes, we consume more of meat. So it would be a challenge for us to generate the biogas. So in order to manage the prototype, it was more of borrowing cow dung to the biodome in order to generate biogas. In the practical sense now, I would really see that it may not really apply here, based on the culture here. People are meat lovers, so it may not really apply. But the essence is, talking of self-regulation and blending it to the realistic sense. Yes, commitment might be there, but the incentive aspect in terms what you had promoted or advocated for in regards to the transport sector, I'm looking at it in a sense, if I relate it to the informal settlements, just thinking out, if we are able to change the norm, like Professor Muhammad was mentioning, changing the norm of people being looked at, if you don't have a toilet, you are looked at as someone who is a threat. How about with the approach of Manyumba Kumi aspect, where it's an incentive with a routine check. If someone has a clean house or a good neighborhood with a clean toilet, that person is rewarded, sort of to change the perspective on that end. Thank you.
Thank you very much. Please promise me you're taking 30 seconds.
Good morning. Good presentations. Mine is a comment. Our biggest threat is perception of what people think. People do not acknowledge themselves as waste producers. They just see themselves as angels. They don't produce any waste, and they're ready to complain about anything. My next comment is when we are doing all this, we need the people, because it's nice to have all these presentations in all these places, but where are the people? Where is the private sector? Why can't we see the manual emptiers? Because you can't talk about them without them, for all of them plus exhausters. You've given me 30 seconds, so I'm done.
Thank you. It was 30 seconds of PowerPoint. Thank you very much for the feedback. I'll give Martha just 30 seconds as well to give you just a parting shot on what you'd like us to remember.
Okay, thank you, Marcy. So mine, I will just go through maybe a few points that maybe had time I would speak about. I think we should think about the enabling environment for the associations or the private sector or the self-regulators. Also, we should think about capacity building and financing models that target them. We should also think about research such that we are not just shooting aimlessly, so that we are able to tell where to invest in and what to do. And lastly, we should not underestimate the political goodwill, because we talk about it all the time in a lot of meetings, but I've seen a situation where the technical class is not able to meet the political class. They are very parallel, and that is not good for business. Thank you.
Thank you very much. Engineer, your parting shots.
Okay. I think what I need to say here is that now that we are looking at self-regulations, it is very important that we consider what we are calling stakeholder engagement. As we do whatever standards that we need to come up with, whatever guidelines that we need to come up with, so that we can now self-regulate ourselves, we need to involve both the government, and in this case we have the county government and the national government, at the national level. We also have the community people. We need to engage them, because these are the people who can be able to own whatever projects that you agree with in terms of sanitation facilities. We also need to engage all the players, sanitation players, make sure that they are well engaged, because by so doing, it means that collaboration becomes very easy. There is also a buy-in. Otherwise, if we don't do that, whatever regulations that we come up with, nobody will be able to accept that, and at the end of the day, we may not be able to achieve anything. Thank you.
Thank you, Engineer. For Prof, I'll ask you a different question as part of your parting shots. What lesson in the case studies that you've had, either globally or even in country, from all that you experience, what would be your parting shot in terms of a lesson that we can pick from?
I think what I would say is, especially if we limit ourselves to on-site sanitation, there is a lot of diversity. There is a lot of diversity, and therefore, if we are considering standards, then we have to take into consideration that diversity from religious perspective, from cultural perspective, and from perceptions. People of Kwale, for example, or Masalani, the southern part of Garissa, children have blood in urine because they have bilharzia. But bilharzia does not carry any morbidity. So when you tell them not to go to swim the river, it doesn't make sense to them, because boys think having blood in urine is part of growing. They think they're just like girls go through that process, So when you come with self-regulation and whatever, you need to do a lot of advocacy to be able to attain a level that these people will see the benefit of what you say. And when we are talking about sanitation, there's a lot of stigmatization. There's a lot of lack of dignity. Toilets in the past, and some places also in the low-income areas, you go and you find some people have beliefs that they write the name of a girl whom they believe once they have written, then they have bewitched that girl to love him. So you find names of women in male's toilet, and you find the men's names in the girls' toilets. I don't know whether people believe that. I thought somebody told me it was true. If you write the girl you love, then she'll come running after you. So this, you need dignity. How do you hold your waist and then write the name of a girl using your own feces? So there is a lot of, whenever we're talking of standards again, CLTS, we need also to consider it is better not to have a toilet than to have a toilet that will be transmitting diseases. The old style of digging a hole would be much better than a toilet that does not meet the basic standard. So issue of standards must be something that the people also can afford, can accept in terms of, again, ergonomics for all the people in the house. If they are elders, then there should be a pedestal that can be maintained in a hygienic way. I see some places they have ropes for the old people, which is tied to the roof, and then they pull themselves when they're standing, because it is very difficult when you squat. And finally, the type of toilet. I think if you bring somebody from the low-income area who is used to that toilet, and then you use WC, in the offices we have problems. People don't yet know how to use it, so they stand on it and it becomes a lot of a problem. So standards and what is acceptable, self-regulation requires a lot of advocacy that we need to do in order to attain those self-regulation at the government level. And the government level is what Martha said here, the goodwill of the politicians. Right now we send people to big meetings, they take their wives, ministers, or take husbands, and they don't value what the information they go to present. Thank you very much.
Thank you very much. A clap for our panelists. Have you been inspired? Have you been inspired? No? Oh, so sorry for the waste of your 1.5 hours. Could we give ourselves a clap? Thank you very much for giving us your time and for taking the time to contribute as well. Really appreciate it. Very good insights from the audience and from the panel. Thank you for taking the time to share your insights and your depth of knowledge and experience with us. We really appreciate. So, but I would like to make a small request. Do you mind if we take a picture? If you can take a picture on the banner, I think that would be a good time to commemorate that we attended this session. Is that okay with us? Thank you. And then after that, just immediately after the picture, we go and take tea. Tea was served at 11:15. Sorry, that came to me quite late. So you'll have about 15 minutes of tea, and then you can go to the next room that interests you. So quickly we can take a picture.
Picture meaning a group photo.
We're not